Lewiston-based community health center is slashing services, laying off more than 30% of its workforce starting May 1st due to a lapse in MaineCare funding. That's the state's version of Medicaid.
More than half of community clinical services patients receive MaineCare to cover a variety of medical services, from dental to mental health counseling. Now patients are worried about missing out on the health care they need. News Center Maine's Vivian Lee has the story from Lewiston.
Ian Dow has no idea where he would be without mental health counseling he receives from community clinical services.
Last winter I was living in a tent and I had a therapist that just kept pushing me, like, you can do it. Just believe in yourself. That's all it takes. Believe in yourself.
Ian just found out that he will be losing access to his counselor and psychiatrist at the beginning of May. Friday, Community Clinical Services began notifying patients that several healthcare programs for low-income individuals are being shut down. Primary care and other health services at CCS's Birch Street Clinic will continue as staff work to get referrals at other MaineCare providers for worried patients.
Who do I see for a counselor now? Where can I be referred to? What do I do now?
Maine currently has a $118 million gap in MaineCare funding, with payments being delayed until June 20th. CCS CEO Colleen Elias says nearly 60% of the health center's patients are on MaineCare, and those delays forced CCS to cut 39 positions.
We don't have cash reserves to sustain any cuts to Medicaid payments, since so much of our operations are funded through primarily reimbursement from MaineCare.
Other medical services on the chopping block. CCS's dental clinic in Auburn, which has 1,800 pediatric patients. Another 700 are on a waiting list. CCS is also closing its school-based clinics at Central Maine Community College, Hebron Academy, Auburn, and Lewiston Middle and High Schools. Lewiston Superintendent Jake Langlis tells News Center in a statement, quote, "As access to medical and clinical care gets more and more difficult, losing this connection for students will certainly have an impact." St. Mary's Regional Medical Center will absorb 3,000 primary care pediatric patients from CCS, and the health center is working on securing federal grants and funding, but it's unknown if that will be a reality under the current Trump administration. Ian, in the meantime, is trying to find a new mental health counselor who takes MaineCare.
It saved me. It's gotten me to where I am in my life.
So he can continue his dream of studying social work in college this fall to help others get on the right path. In Lewiston, Vivian Lee, News Center, Maine.
Republicans in the State House are attempting a referendum to veto the majority budget passed by Democrats last month. If the veto effort gains enough support, it could further delay MaineCare funding until November.